Hello, my friends. Today we will speak about the etiology. What is etiology? Maybe you are listening from a doctor. Etiology is a science about cause of disease. So, etiology is a part of a nosology, part of this science, which is studying how many type of cause disease are exist. For example, let's imagine this is not easy to say when you say a word etiology. So this factor is causing, for example, this disease. Or for example, so we said COVID-19 is a virus is causing the COVID pneumonia and others. So it is a very interesting thing when you are imagining it deeply, you understand that each factor could be a etiological factor, and for one person cold could be a etiological factor, and the second person not. So why this first man is catch a cold in any cases, and the second person not catch a cold, and the one type of factor could be etiological for one person, and second type of factor could be etiological or for second person. So this is a very interesting questions. I try to explain you pointedly. So etiology is a science which is studying the cause of disease. The factors, many factors. For example, you see the streptococcal tonsillitis. For example, you see about malaria. You listen about borreliosis, for example. Each of these type of disease has a one type of etiological factor. Streptococcal tonsillitis etiological factor is a streptococcus as a bacteria. So malaria is caused by the plasmodium of malaria. Borreliosis or Lyme's disease is caused by the Borrelia. It is a bacteria, type of a bacteria. Yes. This is a three type of a different diseases, which caused by a three type of a different factors. So malaria couldn't make the streptococcal tonsillitis, and streptococcal tonsillitis couldn't make the malaria. So this is a very important thing, that in a base of etiology is based on a philosophical determinalism, which we call the determinalism, which is said as that any type of a changement caused by one specific type of factors. So one specific type of factors cause a specific changement, which is based the etiology as a science. Okay, each etiology has a etiology factor could be has a few properties. So first is the unusual factors. For example, you can catch a cold or not catch a cold. You can be in a cold and not catch it. But when your body is acting some acid or some chemical substance which your organism hasn't any defense mechanism for them, this factor could be the etiological factor for the organism. It means that this, for example, at first time when you see the child infection disease, you haven't in a childhood any immunity, yes? For example, any type of virus infection, any type of, and in first time when you met, you haven't any antibodies and any other immunity system for defense, and first time these factors is being as a cause of a disease and unusual as an unusual factor. So unusual factors are a lot of mechanical factors which is broken our bones. So chemical factors which is damaging the tissue, for example acids. Second property of etiological factor is a redundance or insufficiency of a factor. Let me explain. For example, one factor when it's in normal condition is not etiological factor. When it become an insufficiency or it become a redundancy level, it is becoming as an etiological factor. For example, look, there's a very beautiful example as glucose in a blood. When glucose level is going down, the brain is lost his functionality, and this person lost his consciousness. So we call glycemic coma. Yes, but in normal physiological condition level, it is acting as a physiological factor, glucose. When the glucose is becoming a high level in the blood, and it's one type of time after the one time, it's damaged the proteins in the body, in the vessels, in the nerves, and the diabetes disease is become. So high level of glucose causing one type of disease, which we call diabetes. Insufficiency of glucose cause a second type of a disease, which we call the hypoglycemic coma. So this is a second property which we say insufficiency or redundance of factors. Third property of etiological factors, it is a changing of a frequency or a changement of a duration of any type of factors. For example, if you not sleep one day, there is no problem. You will sleep later. But when you lost, for example, patient lost sleep ability and he can't sleep about 2 weeks or more, these factors could become as a etiological factor for example, neurosis. Look, for example, somebody say I'm working at night 10 days. For example, me, I'm in hospital. Yes, and if some person is not sleep 7, 8, 10 days in a hospital, so after then he can irritate and it can become as neurosis. So insufficient of sleep, duration of sleep, synchronous process of brain could be the etiological factors of neurosis. And the last property, which is very interesting, that it is a combination etiological factor with indifferent pathological factors. For example, there is one factor, it is indifferent factors. It himself, he can't cause a disease. He can't. But when he met some indifferent factors, these indifferent factors change the ability of the indifferent factors, and this both combination make this indifferent factor as a harm factor, as a cause of one type of a disease. Okay, we will speak about this pen indifferent factors a little bit later. So I hope you understand. And sometimes there is a factor that any one etiological factors need more etiological factor combination. For example, 2 type of etiological factors with making some disease. This is a combination of 2 polyetiological factors, we say. For example, hypertensive diseases, polyetiological diseases. For example, it depends. We will speak about later, but just let them understand what about qualification of etiological factors. So let's speak about pointly when these indifferent factors itself with indifference, and second second factors, etiological factors is not etiological, and second indifferent factors change this factor ability, and this becoming as a etiological factors, as a cause of disease. So we say it as a condition of disease. Please remember, any type of etiological factors in these cases depends on a condition. The condition is change the etiological factors damaging level, and it could be stopped or it could activate the etiology and the disease. So in classification, condition could be decisive factors. This role could be decisive, K factor, and insignificant factors. Whereas condition can either promote the realization of the cause of the disease or hinder its development. For example, in some cases, the patients say, I'm very fastly catching a cold and being in influence or chronic tonsillitis, or I have a fastly tonsillitis, 2-3 type of amount of years. So it is unlogically that we think that he 3 time in a years catching the same bacteria. Yes, but let's think. The bacterial is caused the tonsillitis. So of course it is a tonsillitis. It is not chronic tonsillitis. It is acute tonsillitis. Anytime organism while treating himself, after that he catching a cold or catching this bacteria and make a tonsillitis again. Why? Because when some people say that I have no insufficiency of defense immune system, local or general. So if the tonsillitis becomes affecting by bacteria, so the immune deficits there is a role of a condition. Okay, do you understand? When we have immune deficiency, this is a condition factor for a bacterial attack on a tonsillar nodes. So this when the patient say, for example, I'm 2-3 times of year I catching this bacteria and I ill by the bacterial tonsillitis. So we speak that about bacterial tonsillitis. We understand that tonsillitis become by the bacterial affection as etiological factor, but we have to and we must to please remember in any time, do not forget about condition of a factor. For example, one type of a bacteria is becoming a pathological for in a pH, in an acid or stage environment, or in a depend on a temperature, for example. Yes, this is acid level, temperature, and other factors is acting as a modifying factor of this etiological factor. So it is condition for etiological factor. Please do not remember in any time in your whole life, because when you even change the condition factor, you change the etiological factor activity, and it is a more than 50% work. So in general, we divide conditions into 2 types: external and internal. Yes. So external type could be environmental factors. So pooled air, water, exposure to chemical and physical factors, quantitative and qualitative nutrition deficiency, or change in the regimen, thermal affection, social factors such as emotionally favorite situations. Okay, insufficient of sleep. This is the external factors which is acting as a condition. So I show you example. If I not sleep 7 days, I become a neurosis. Yes, but I hope when you work in a hospital, it is usual for you also. But don't worry, it is treated yourself. So there is a very interesting. We speak about the internal factors. The first is resistance. So we have an immune resistance. We have a psychostrical resistance. We have a thermal resistance. We have any type of resistance of our organism, which is defense by acting as a etiological factor on our body. Yes, we speak about the resistance after in a lecture when we speak about pathogenesis. So second point of condition is a feature of a constitution. You know what we say when we say the constitution. So when you learning inner disease, you pay attention with that. We say three type of a constitution: asthenic, normosthenic, hypersthenic. But this is a just one type of a classification. So constitution. Do you remember when we speak about that any functioning morphology and any morphological changement is acting as a functioning changement? So any structure, any type of structure has its specific ability of functionality. Yes? So any type of a constitution, which is a general concept of a morphological type, has his appropriate functionality. For example, you learn in physiology that the nervous system is divided into four types by its work. So melancholic, sanguinic, choleric, yes, is different. Choleric, and each type of classification, each type has its neurological development process in our brain. So inhibition and activation of the neurons is divided into these four types. For example, if melancholic C1 dramatic feel, it could become a depressive, but if like for choleric it is a normal, and he can even, I don't know, not pay attention so much. But for this factor depends on a type of a nervous system, which is a type of feature of a constitution of a nervous system, and this type of factor can affect on a various type of constitutional nervous system. I hope you understand. So any type of a constitution, it is based on morphology and function interaction to each others, and in each type of a constitution can affect by any other type of etiological factor and can resist by others. Okay. Second is a constitution. Type of a higher nervous system, activity, gender, and age. So type of a nervous system we speak about just now. That and the gender and age, it is for example, you know that the women are more resistant than losing blood in anemia than the men. It is also combined by the constitution, but division of constitution is becoming by the gender and age. Age. Do you remember when you be in childhood? Yes? Even when you drink a cold water, after few time you have a running temperature, you have some illness and so on, but after some years it become a normal. You can now drink a cold water, it is a normal. Why? Let me drink. The water, cold water, it is a normal, it is a non-unusual, it is a usual. But in the childhood there is two processes. You have some level, some of the people have chronic tonsillitis or chronic inflammation processes. But in general, the non-adaptive reaction of organism, they're not coordinate. So the cold water could harm your body, and your organism in a childhood can defend properly, and it became the inflammation and the pathological process. If in this case, when the patient hasn't any the chronic inflammation, because the cold water in that case can activate as chronic inflammation. So in second stage, it is a factor condition which is activate the inner etiological factor. Okay, so make me conclude about this lecture, and please remember, when we see about etiological factors, we understand that the non-specific, specific etiological factors, but do not forget about the condition of etiological factors, which is change the activity, and the condition is a very good target for treating even without drugs. You change a condition, change the pathological process. Okay, thank you.